Myeloma features. Multiple myeloma is a neoplasm of the bone marrow plasma cells. The peak incidence is patients aged 60 to 70 years. Clinical features. Bone disease, bone pain, osteoporosis plus pathological fractures, typically vertebral osteolytic lesions. Times lethargy. Times infection. Times hypercalcemia, see below. Times renal failure. Times other features, amyloidosis e.g. macroglossia, carpal tunnel syndrome, neuropathy, hyperviscosity. Investigations. Times monoclonal proteins, usually Ig or Ig, in the serum and urine, Bence-Jones proteins. Times increased plasma cells in the bone marrow. Times historically a skeletal survey has been done to look for bone lesions. However, whole-body MRI is increasingly used and is now recommended in the 2016 NICE guidelines. Times X-rays, raindrop skull, likened to the pattern rain forms after hitting a surface and splashing, where it leaves a random pattern of dark spots. Note that a very similar, but subtly different finding is found in primary hyperparathyroidism, Epperpot skull. The diagnostic criteria for multiple myeloma requires 1 major and 1 minor criteria or 3 minor criteria in an individual who has signs or symptoms of multiple myeloma. Major criteria. Times plasmacytoma, as demonstrated on evaluation of biopsy specimen. Times 30% plasma cells in a bone marrow sample. Times elevated levels of M protein in the blood or urine. Minor criteria. Times 10% to 30% plasma cells in a bone marrow sample. Times minor elevations in the level of M protein in the blood or urine. Times osteolytic lesions, as demonstrated on imaging studies. Times low levels of antibodies, not produced by the cancer cells, in the blood. Hypercalcemia in myeloma. Times primary factor, due primarily to increased osteoclastic bone resorption caused by local cytokines, e.g. IL-1, tumor necrosis factor, released by the myeloma cells. Times much less common contributing factors, impaired renal function, increased renal tubular calcium reabsorption and elevated PTHrP levels.